Hello, everyone. Welcome to Hearing Partners Zoom series. I am Dr. Yunette Solorzano, and today I will be talking with you about hearing loss and heart health. I'm going to be sharing a presentation that you can follow along, and we will answer any questions you may have at the end of the presentation. And we also encourage you to ask any questions that you may have regarding your hearing loss and heart health with your audiologist. Okay. So like I mentioned, I am Dr. Yunette Solorzano, and I am a doctor of audiology at Hearing Partners Boynton Beach location. Thank you for joining us today for our February Zoom series. February is Heart Health Month, so this month's Zoom series is on heart health and hearing loss. Last month, we talked about how hearing loss and cognitive decline are related and discussed some ways to help preserve cognitive function. If you missed that lecture and you're interested in learning more about that, contact us and we will send you a link so you can watch the presentation. Today, we're going to talk about different ways in which heart disease can be correlated to hearing loss and the mechanisms that affect both. Feel free to write any questions in the chat as they come up, and we will have a question and answer portion at the end of the presentation for those that are live with us today. Okay, we will start the presentation talking about the ways in which aging plays a role in both heart disease and hearing loss. People aged 65 and older are much more likely than younger people to suffer a heart attack or have a stroke or develop coronary heart disease. For example, as you get older, your heart can't beat as fast during physical activity or times of stress as it did when you were younger. Aging can also cause changes in the heart and blood vessels, and the most common aging change for the heart is an increase in the stiffness of the arteries, which can lead to hypertension. Now, here are some facts about hearing loss and aging. Hearing loss is the third most prevalent chronic health condition facing older adults today. It follows hypertension, which we just talked about, and arthritis. 1 in 3 people between 65 and 74 will experience some degree of hearing loss. And half of people older than 75 have hearing difficulties. Now, a tidbit about hearing loss is that on average, it takes someone about 7 years to seek help for a hearing loss. So let's talk about some common signs of heart disease. Early heart disease doesn't often have symptoms, or the symptoms may be barely noticeable. That's why regular checkups with your doctor are important. However, there are some signs you can look out for and speak with your doctor about. And here's a list of them. I'll review them with you. Pain, numbness, and or tingling in the shoulders, arms, neck, jaw, or back. Shortness of breath when active or just when laying flat. Chest pain during physical activity. That gets better when you stop the physical activity or when you rest. Lightheadedness, dizziness, confusion, headaches, cold sweats, nausea, vomiting, tiredness or fatigue, all of these things that seem to have no other cause while they're happening. Swelling in the ankles, feet, legs, stomach, and or neck. Reduced ability to exercise or be physically active. Or just problems doing your normal activities, things that seem to be things that you were able to do easily before becoming harder. So heart disease is often hard to detect until it has progressed. But knowing some of the signs can help a patient stop or slow its progression. So along with the signs that I listed before, one of the earliest signs of heart disease is hearing loss. The relationship between hearing loss and cardiovascular disease has been well documented in the medical research. But it's important for the general public to also be aware of it. And I don't think it's something that's really talked about a lot. How is it related? Well, the relationship between hearing loss and cardiovascular disease is plain and simple. It's all about the blood flow. If your heart is distressed, blood and oxygen does not travel around your body as well as it should. And that inadequate blood flow to the inner ear can contribute to hearing loss. It can also cause trauma to the blood vessels of the inner ear that need a healthy supply of blood. Research indicates that individuals with cardiovascular issues are 50% more likely to experience hearing loss. And nearly 80% of patients who had at least one heart attack also had damage to their inner ear. Okay, so now let's talk briefly about how the auditory system works and how hearing loss happens. So on the screen, you will see a diagram of the auditory system. We have the outer ear, the middle ear, and the inner ear. And I'll tell you a little bit about how the sound travels from one to the other. So first, a sound is made in the environment, and it is funneled by the pinna, right here, which is the outer ear. It then enters the ear canal, and it reaches this right here, which is the eardrum. That sound wave vibrates the eardrum, and then it passes through the smallest bones in our bodies, the ossicles, within the middle ear system. Once it makes it through that system, it then enters here, the cochlea. This is what we consider the inner ear. And this part of the inner ear, the cochlea, is where age-related hearing loss occurs. And it's also the place where heart disease and blood flow can impact. So let's take a closer look inside the cochlea. So the cochlea is kind of snail-shaped, and different areas of the cochlea are responsible for transmitting different types of sounds. There are these little hair cells inside of the cochlea, and they are organized based on the frequencies we hear. So there are places that are responsible for low frequencies right here, like 500 hertz, that's a low frequency sound. Sometimes background noise can be considered low frequency. Male voices can also be considered lower frequency. And then as we unravel the cochlea, we come into those higher tones, those higher frequencies, and they also have a place within the cochlea. So for example, female voices tend to be higher pitched, children's voices as well, and consonants in speech, which give us clarity to speech. We're going to talk a little bit more about these little hair cells and how they are impacted by blood flow. But first, let's take a look at why blood flow can impact hearing. So the organ of hearing, and this is another diagram of it. Here's that cochlea, snail-shaped cochlea again. The organ of hearing is the smallest organ within our body, and this is called the cochlea. And you can see on the diagram that it has a very small blood supply. So here we have a basilar artery, and then another artery that allows the cochlea to receive its blood supply. If your heart is distressed and blood and oxygen cannot travel around your body as well as it should, then that means that an inadequate amount of blood supply will reach the cochlea. And this can cause trauma not only to the blood vessels of the inner ear, but all around this area. And specifically, this is based on the hair cells in the ear. So these little hair cells also need a good amount of blood supply to do their job efficiently. When they do not receive the oxygen they need, they can become damaged. So in this photo on top, you can see these little hair cells lined up correctly the way that they should. And they are responsible for carrying the sound down the auditory system. Now in the bottom photo here, this is a photo of hair cells that have been damaged or that are missing. This means the message that gets carried to the brain from here will not include the full signal that it's out in the environment. It will be distorted. Hair cells can become damaged due to many reasons. For example, the aging process, exposure to medication, the environment, or exposure to loud noises. Those are just some examples. However, they can also become damaged due to poor blood supply from the heart. And unfortunately, these hair cells do not grow back. So hearing loss may become permanent. All right, so we discussed how heart health can be related to hearing loss and how both are some of the leading health conditions facing older adults today. So what can you do about it? Well, here are some treatment options. For hearing loss, the first step is visiting your audiologist and getting a full diagnostic hearing examination. This will allow your audiologist to find the degree and the type of hearing loss you have and give you information on how this deficit is affecting your everyday life. The audiologist will also be able to recommend the appropriate treatment for you, which can range from hearing aids to cochlear implants or different things to help you receive the information that's in the environment appropriately. Your treatment option chosen will allow your brain to start to rehabilitate to the sounds that the ears have not been providing. And these changes can be very good for you, not just in the level of the brain, medically speaking, but also can help you encourage more social activity, which can also help your heart health. So when it comes to preventing heart disease, here's some steps you can take to keep a healthy heart. First step is to ensure you talk with your doctor about any risk factors or signs of heart disease you may have. Engage in physical activity. So talk with your doctor about what kind of physical activity may be right for you. But on average, it's recommended that you engage in about 2 hours of physical activity every week. This could be something like going for a walk with a friend, or joining some kind of sports league or something that will keep you active a couple of times a week. If you smoke, quit. Research has shown all of the health risks of smoking, including damaging the artery walls of the heart. Try to follow a healthy diet. That means choosing foods that are low in saturated fats, added sugars, and salt. Next month, we're going to talk about nutrition, so I'll have more information for you about that. Maintain a healthy weight. Some ways you can do that include limiting portion size of what's being eaten, but also adding physical activity to your daily life. Maintain diabetes, high blood pressure, and cholesterol all under control. And finally, manage your stress. Learn how to manage stress, how to relax, and cope with problems to improve physical and emotional health. Well, this is the end of our lecture on heart health and hearing loss. I hope with this information you can be encouraged to keep an eye on your hearing and also share the fact that hearing loss may be a sign of heart disease with friends and family. It is important to have a team of doctors who work together to treat all aspects of your health, and we're happy to be a part of your healthcare team. Thank you very much for listening and joining me today. I would love to answer any questions that you have. You can also contact me at our Boynton location for a hearing test and to discuss any questions you may have on hearing loss and how it may be related to your heart health. Also, please keep an eye out for our future Zoom series. Coming in March, we're going to be talking about nutrition and hearing health. Thank you once again for joining me today. I look forward to seeing you next month during Nutrition Month.